My name is Alexis Scampini, and I know that you've already seen my background in the application, so I'm going to get straight to the point. Why I'm so interested and passionate about this opportunity. I'm actually speaking to you from Rome, Italy, where I'm studying abroad this semester. Stepping away from my traditional science classes has truly motivated me to grow in a completely different direction. Traveling and experiencing new cultures has shaped the way I look at and want to continue practicing medicine. Here in Rome, I volunteer in the community. I do a variety of different service work, but this one in particular I look forward to the most every week. Every Wednesday, I meet with a group of elderly Italians and help them read medical and scientific articles so they can practice English and feel more confident navigating health related information. One of them is a retired doctor, and our conversations about the differences between European and US healthcare have been eye opening. And now I want to focus on some of those qualities back home, like prioritizing prevention based care and really taking time with patients individually. That global perspective, combined with my EMT and clinical experiences, have made me realize how much I value learning in places that focus on authenticity and human connection. So, why do I want to be a Pathmaker intern? Because your program displays these qualities to me. Last spring, I was selected to participate in a Torero trek to your campus where I experienced your collaborative, innovative, and personable environment. After talking with Dr. Ginther and hearing him say, time is going to pass by anyway, so you have to choose what you want to do with it, I knew I was going to apply to this internship program. Additionally, what makes me feel most fulfilled is not only applying my knowledge, but also connecting with patients and as individual people and showing them that they truly matter. One of my first EMT ride alongs, I transported several elderly patients between hospitals and nursing homes or SNFs. While it was incredibly exciting to see what I had learned in class really play out in real life, what surprised me the most was how meaningful it was and how memorable it was talking with these patients in the back of the ambulance and making them feel seen as whole people. I've shadowed surgeons, worked in urgent care and phlebotomy clinics, and I feel like Pathmaker is the perfect next step and the perfect opportunity to bring all these skills together. I'm especially excited about the rotation experience, getting time to spend in surgery, outpatient clinics, rehab facilities, and more. I want to learn directly from nurses, physicians, physicians' assistants, and truly understand how each care team communicates and functions together and separately. That is why I want to be a Pathmaker intern. I aspire to firstly build a well rounded understanding of healthcare by rotating through these different departments. Secondly, I want to learn from these mentors. And finally, I want to discover how I can make the biggest impact as a future provider and grow as a leader. I plan to achieve these goals by being fully committed to the 240 hours or more. I'm dependable, assertive, and proactive, and I give my all to the work that I do because I have a genuine passion for this field. I want to continue to learn at Palomar from mentors like Dr. Ginther and grow into a provider that leads with skill, empathy, and compassion. Thank you so much for this time and consideration, and I would be honored to be part of your team.